Hello everyone. Today we will talk about the obvious signs of serious kidney problems. The video will also help you learn about the causes of kidney diseases and how to protect them. Therefore, please watch the video to the end. I also want to mention those who are not subscribed to the channel but watch it. Appreciate the work of the team. Subscribe and click on the bell icon so that the subscribe button turns into subscribed. Thank you in advance and enjoy watching. Kidney and urinary tract disease is very common in the modern world. This is a serious problem that needs to be treated in a timely manner to avoid missing the disease. We will look at its main signs. With their help, you will be able to identify the problem and consult a specialist. Signs of serious kidney problems. 1. Itching and dryness of the skin. Diseased kidneys filter urine and metabolic products poorly. Urea irritates nerve endings on the skin, causing itching. It is strong and different from ordinary allergies. Such itching often occurs at night and does not go away after taking antihistamines. Persistent itching leads to the appearance of scratches on the skin and injuries, increasing the risk of wound infection. 2. Frequent urination. This symptom occurs with many diseases. Kidney problems are no exception. When they are affected, urine filtration and concentration are disrupted. As a result, a person wants to go to the toilet often, especially at night. Such symptoms also occur with diabetes and inflammation of the urinary tract, so it is important to consult a doctor in time to make a diagnosis. 3. Fatigue, weakness, and lethargy, as well as decreased performance, often reflect diseased kidneys. The damaged organ cannot filter out harmful substances and toxins, so they accumulate in the blood and negatively affect the body in chronic diseases. Kidneys lose the ability to synthesize erythropoietin, a substance that promotes the maturation of erythrocytes. With its deficiency, anemia develops, which also causes symptoms of fatigue. Their peculiarity is constancy and duration, which do not disappear even after sleep or prolonged rest. This anemia can be treated and controlled if you consult a doctor in time. 4. Sleep problems due to insufficient removal of harmful substances from the body. They circulate in the blood and irritate all organs and tissues of the human body, including the nervous system. This leads to sleep disturbances. If you are bothered by frequent awakenings or insomnia, it is better to consult a doctor to find the cause. Kidney problems can be one of them. 5. Decreased appetite. This symptom is nonspecific and occurs with many diseases. However, if you notice such signs in yourself, remember that diseased kidneys may be the cause. When the organ is affected, it cannot filter the blood properly. As a result, toxins and harmful substances accumulate in the body. Their toxic effects lead to a decrease in appetite, weakness, and other symptoms. It is impossible to solve the problem on your own, so it is better to immediately consult a doctor. 6. Blood and urine. When kidney filtration is disrupted, blood appears in the urine. These may be minor changes that only a doctor will detect during tests. Or there may be significant changes when the urine turns red. Such symptoms occur with kidney inflammation, sometimes with tumors or urinary tract stones. These diseases cannot be treated at home, so you should visit a doctor. 7. Swelling of the limbs. As the disease progresses, edema appears not only under the eyes but also all over the body. This condition is associated with a significant loss of protein and insufficient fluid removal. Swelling appears on the legs and rises higher as the disease progresses. You will notice changes immediately, as it will become difficult for you to put on shoes, and there will be marks and indentations from socks. Leg swelling also occurs with heart disease and varicose veins. 8. Swelling under the eyes. The appearance of swelling specifically in this area indicates kidney problems. Due to poor blood filtration with urine, a lot of protein is excreted. This disrupts oncotic pressure, and fluid comes out of the cells, causing swelling. Pay attention to this problem if you have such symptoms. 9. Cramps with kidney damage. Such a symptom is not uncommon. It is associated with an imbalance in the blood electrolyte composition. Increased potassium or calcium deficiency causes cramps. Such symptoms also occur with damage to the nervous system and other diseases. Do not delay visiting a doctor if you notice such phenomena in yourself. 10. Shortness of breath. This symptom occurs with many diseases. When the kidneys are affected, shortness of breath is caused by the accumulation of fluid and its appearance in the lungs, as well as anemia, which leads to a lack of oxygen in the body's cells. Forced to breathe more often, the body tries to ensure the necessary saturation of tissues. If you have shortness of breath, evaluate all the above symptoms. If you have any of them, the problem may be with your kidneys. If not, the causes may be heart or lung disease. The main thing is not to panic and see a doctor in time to find the disease. 11. Feeling cold. Constant chills and feeling cold are not normal. Everyone reacts differently to temperature changes, but you should not be cold in warmth. If such symptoms occur, the cause may be kidney pathology. It leads to the development of anemia and a decrease in hemoglobin. Such changes often cause a person to falsely feel cold. It is better to see a doctor and take a blood test for diagnosis. 12. Confusion. We mentioned earlier that when the kidneys are damaged, the production of erythropoietin decreases. This leads to a lack of hemoglobin and the development of anemia. Oxygen starvation of the cells and tissues of the body, especially the brain, manifests itself as impaired mental activity. This disrupts memory and causes confusion. The situation is dangerous because a person forgets what they did or said a few days ago. 13. Bad breath. Bad breath is not always due to teeth or stomach problems. This symptom also occurs with kidney damage. It is not related to hygiene or lifestyle. The problem is the accumulation of harmful substances and their damaging effects. The problem can only be solved by eliminating the underlying disease. Therefore, visit a doctor immediately. 14. Metallic taste. Changes in taste with chronic kidney disease are due to the accumulation of urates in the blood. They negatively affect all cells and tissues, disrupting food perception. Foods that are familiar to you become unpleasant or acquire a metallic taste. As the disease progresses, a person stops eating meat. In more severe cases, the appetite disappears altogether. 15. Dizziness and weakness. We have already mentioned that weakness is a consequence of anemia, which develops with chronic kidney disease. With a lack of red blood cells and hemoglobin, the cells and tissues of the body lack oxygen. This leads to coughing and dizziness. Memory and attention can also be impaired. This condition is dangerous because dizziness or sudden weakness can occur anywhere and endanger your life. Causes of kidney diseases. There are many factors that contribute to kidney and urinary tract diseases. Among them, we can distinguish those that influence from the outside and those that affect from within. Here are the main reasons. Exposure to low temperatures can lead to hypothermia. This can provoke the development of infections and inflammation of the kidneys or other organs of the urinary system. Harmful habits damage all cells and tissues in the body. The kidneys are no exception. When alcohol is consumed, all ethanol is filtered by this organ. Prolonged or constant alcohol exposure disrupts kidney function. This manifests as a decrease in its filtration and concentration functions. In severe cases, chronic kidney failure can occur. Various bacteria or viruses cause inflammation of the kidney tissues. Infection is the most common cause of pathology in this organ. Intestinal problems can negatively affect kidney function. Prolonged stagnation in the intestines leads to the process of decay. All harmful substances are reabsorbed into the bloodstream and then filtered by the kidneys. This causes damage to them and disrupts their function. Stress and emotional background indirectly affect the kidneys. They weaken the immune system and the body's protective forces, making it susceptible to infections. This leads to various inflammatory diseases of the urinary tract. Prevention of kidney diseases. Refrain from harmful habits such as alcohol and smoking. Promptly seek medical attention and monitor your health condition. Treat inflammatory diseases and other kidney damage. Try not to overcool, avoid sharp temperature changes. Adhere to the principles of proper nutrition, eat often but in small portions, Exclude smoked and spicy foods, as well as processed foods from your diet. Regularly undergo medical checkups at the clinic. When cooking, stewing, or boiling, include plenty of vegetables, greens, and fruits in your diet. Maintain adequate intimate hygiene. Prevent the occurrence of prolonged constipation. Maintain physical activity. This concludes the video. On the channel, you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as about diseases and their treatment methods. So please don't forget to subscribe to the channel and click on the bell. I would also appreciate it if you like and share the video with your family and friends. This was the Health Body channel. Until next time.